Welcome back. This section of the show is called Ask FPA. You can send your questions to tv@fpalex.com and include your name if you would like for us to use it on the air. Tonight's question is asked by Lisa in Lexington. It says, what is the difference between irritable bowel syndrome, Crohn's disease, and diverticulitis? And here to help me answer that question is my colleague, nurse practitioner Todd Martin at Family Practice Associates. Welcome.
Good evening.
All right, I'm going to take a shot at the irritable bowel syndrome. It's usually cramping and bloating and bowel changes, but doesn't really involve colon tissue or cancer risk. Crohn's disease does involve tissue. It has bleeding, can be a little bit more severe. And then there's diverticulitis, which is not related to either one of those, and you're going to help us tell about that.
Try to solve that puzzle.
There you go. Now, diverticulitis versus diverticulosis, what's the difference?
So diverticulosis are pouches that form along the colon wall. Causes of these, we're not real sure, but we think some things contribute. Obesity, not enough fiber in your diet, dehydration, cigarette smoking, all have been linked to the formation of diverticular pouches. When those diverticular pouches become infected, it becomes diverticulitis.
So a lot of people have diverticulosis but never end up with diverticulitis.
That is correct.
Okay, so what are some symptoms that you might have? Say, oh, I need to check this out.
Yeah, so symptoms of diverticulosis, most of the time it has no symptoms at all. You might feel bloated, you might have excessive gas, but most of the time you have no symptoms at all. When it becomes diverticulitis, typically you have left lower abdominal pain. You'll sometimes run a fever, a lot of discomfort. Sometimes you'll have diarrhea, occasionally bloody stools with that.
Now, you said usually left lower quadrant, but it could be anywhere?
Could be anywhere.
So how do you know you have diverticulosis?
So most people don't know they have diverticulosis unless it's incidentally found on a colonoscopy or on a CAT scan that they're looking for something else.
Okay, now, so let's say you examine a patient, they've got left lower quadrant pain, you're thinking diverticulitis. What's the next step?
So the next step is to order a CT scan of their abdomen to evaluate that, because the worrisome things about diverticulitis is occasionally they can get so bad that they rupture, and when they rupture, there's a risk of peritonitis, which is when the infection kind of spreads from the colon into the abdominal cavity, which can be life-threatening.
So that's when you say bad pain, fever, that's something you got to pay attention to.
Correct.
Like a ruptured appendix, except it's a diverticuli.
Exactly.
Okay, is there other ways to evaluate this? Let's say you know somebody has diverticulitis, they've had it before. You need a CAT scan every time, and if you suspect that, what do you do about it?
You don't always need a CAT scan. If you're really suspicious on clinical exam, you should definitely get a CAT scan. But a lot of times they've had it before, they're not running a fever, they don't look what we call toxic, look really sick. We'll put them on a couple different antibiotics, an antispasmodic to kind of slow the colon down, and treat them as an outpatient. Most of the time they get better in a few days, kind of have them eat a blandish diet, nothing spicy.
Some people end up with surgery.
Some people end up with surgery. So people who have recurrent diverticulitis attacks, where they just have many in a year, or a really bad one that perforates, there is an option of removing that portion of the bowel that has diverticulosis. That's called a lower bowel resection or a colectomy. And they go in, nowadays they do it mostly robotically. So you have 3 small incisions, they go in, they take out the diseased portion of the bowel, reattach the other areas, and you go on with your life.
All right. So real quickly, if I've got diverticulosis and I don't want to end up with diverticulitis, are there things that I can do to avoid that?
There is. High fiber diet, fruits and vegetables, plenty of fluids, lose weight, exercise, all those things can kind of prevent diverticulitis from occurring.
Okay, one quick question. Do seeds really make a difference? Do you have to avoid seeds?
Years ago, we used to think seeds made a huge difference. As you chewed them up, they were these little sharp shards that didn't digest really well, and they would pack into the pouches, and the thought was that they would cause scratches in the pouches, which would become infected. But they've since kind of disproven that. So really, you can eat what you want, lots of fiber, and stay hydrated.
All right. Thanks for coming in. Appreciate it. Great information.